Hey, I'm Dr. Seuss at Clackamas Smiles. I'm here to tell you a little bit about root canals. We get a lot of questions. What are they? Who needs them? What's the process behind them? So I'm here to answer some questions about root canals today. Root canal treatment is when the inside of the tooth is either dead or it has bacteria in it and it's become unhealthy. That can spread bacteria around the roots of the teeth and spread to other teeth. It can cause infections and health problems. A root canal is when that bacteria is cleaned out of the center of a tooth so that the tooth can be fixed, so it can be kept, so you can still chew and bite and function normally and keep that tooth. You might have a couple signs that you might need a root canal, one of which is really obvious. It's when you have infection and pain. It's when you get a large swelling around a tooth. It's when it's hurting you. Those are all things that can signify the root is unhealthy. The nerve inside the tooth is malfunctioning. That's a case when you might need a root canal. But there's a second situation, and that's when the nerve has died in a tooth and there's a small infection that started. That doesn't necessarily come with a lot of symptoms. So it's possible that you can be told that you need a root canal, even if that tooth doesn't have pain, it's not seemingly malfunctioning, even if you don't have outward signs of infection. If that infection has started at the root tip, but before symptoms have happened, that's still a great reason to get a root canal to prevent future infection and keep it from spreading. So let's say you need a root canal, but you don't get one. What's going to happen? There's two sort of choices of what might happen, and one is really good. It might be very slow growing, and you might have a little bit of time before you have pain or infection. But the other thing that you need to watch out for is, given enough time, those dead nerves and that bacteria building up will spread. It'll get bigger. It'll cause damage to the bone. It can cause loosening or fracture of tooth, and that kind of infection can spread to the surrounding tissues. So that's not something that you want to play games with, and it's certainly not something that you want to postpone. Root canals can be performed by either a regular dentist, called a general dentist, or a root canal specialist. If you have a tooth that's incredibly complex, if there's something going on in the root system, if there's a lot of twists and turns, your general dentist might ask you to go see a specialist. But the majority of root canals are simple and they're straightforward, and they're actually completed at your regular dentist's office. So when we get the question, do patients prefer root canals or implants? That's a personal preference. You can have usually one or the other. The other question is, would your dentist recommend a root canal or an implant? And that can depend on a lot of factors. If that root is really strong and it's long and it's healthy and it's just a factor of having bacteria in it, then that's fine. And I think that's a great tooth to save. On the other hand, if a tooth is severely broken down, if it has a lot of challenges, if it's lost some bone around it, even if the patient's really motivated to keep that tooth and they say, can I have a root canal? Can I keep that tooth? Your dentist still might recommend that it's not a good idea. There's just too many things stacked up against that tooth and you'd be better off replacing it. Do root canals save teeth? Absolutely. They save teeth all of the time. You need to make sure that the tooth is worth saving. It has a good foundation, it has good bone around it, and that it's not too broken down. And if that's the case, that's one of the best situations to save a tooth by doing a root canal. On the other hand, if that tooth is really broken down, if it's just not doing well, or if it has big problems with its foundation, then you might not want to keep it. You should really consider replacing that tooth, possibly with an implant. The different stages or the steps of root canal treatment are as simple as taking out the infection, getting it stopped, and putting a medication inside that tooth. The second step would be cleaning it out, disinfecting it, and making sure that there's no bacteria left over. And one of the last steps or stages of root canal treatment is putting the final sealer or the filler inside. We don't want anything else to come back in, and we definitely don't want bacteria to come back in. Now, most root canals, we do all of those steps at the same time, so you don't even notice that there's 3 distinct steps. But in some cases, when the infection is large or when the tooth is much more complex, we'll break those down into separate steps. So it's possible you could have a 2-appointment root canal instead of a 1-appointment root canal. Ask your dentist which is best for you. Let's face it, root canals have a terrible reputation. There's jokes about them. There's the media talks about them. Everyone, it's the dreaded root canal. And I used to think the same thing before I went to dental school. The reality is root canals are really boring. You're there for a long time and that's not fun, but there's nothing exciting happening and the tooth is incredibly numb. You're staring at the ceiling or even dozing off. So root canals aren't this big scary thing that most people think that they are. That being said, people still ask about, is sedation available? Can I have something to help me calm my nerves? And that's also something really common that we do. So if you're concerned about that, ask the question, hey, can I have something to calm my nerves? And the answer almost always is yes. We talked about root canals having a bad reputation, and there's something else out there in the media that root canals are dangerous, that they're harmful for your health, that they cause all sorts of of ills, and we find that's not actually the case. Just like with any dental treatment, root canals can have side effects, and they're not 100% successful. That would give someone kind of a bad experience with a root canal, and you might even know someone who said, oh, well, I had a root canal and it didn't work. Sure, that's possible, but root canals aren't dangerous for your health. They're not hazardous for your health, and they're not causing a whole host of health problems. So when we look at the research, we look at the literature, that's just not something that's realistically happening. There's one really main side effect of root canal treatment, and that it gets rid of your pain. That's a fantastic thing. If you have a painful tooth, if you have a malfunctioning nerve, that tooth isn't doing well, and that tooth is sending you a bunch of pain signals. Now, when we take out that nerve, when we disinfect it, when we treat that and make it better, most of the time pain goes away. So people think, oh, root canal causes all this pain. And the reality is a root canal is a pain relieving step. It's also something that prolongs the life of the tooth and lets you keep that tooth in your head. So those are great things. You're getting rid of pain. You're preserving the tooth. You're letting it function. You're really sort of getting your smile, your chew, and your ability to speak back. Those are fantastic. So I don't think you should have any reservations or qualms about getting a root canal. Let's talk about what you should do after a root canal. Now, once the pain is gone, it's usually out of sight, out of mind. The patient's like, that feels a lot better. It wasn't horrible. I think we're still on speaking terms with the dentist. But after a root canal, it is important to protect the top of the tooth. So picture this. If you have an intact tooth and we make an opening to go in and clean out the root system, once that's done, that opening can compromise the top of the tooth. That needs to be either fixed or repaired or somehow protected. One of the ways that we do that, especially with back teeth, is by using a crown or a cap. It goes over the top of the tooth and it protects it. It keeps those walls from fracturing, or it keeps that opening from coming back up. So kind of like a helmet on top of a tooth that protects that area afterwards. So you'll likely be told if it's a back tooth, you need a cap or a crown after a root canal. That's considered routine. After undergoing root canal treatment, there's one big rule, and that's take it easy. Just don't overdo it. Treat the tooth nice, get your recovery finished. Now, the other thing that we talked about earlier was you need something over top of that tooth to protect it. If that tooth had an opening in order to do the root canal, that can compromise the structure, and that needs to be repaired or somehow protected. So the thing you should do is take it easy, don't overdo it, and then really look to that next step of, does this tooth need a crown? Does this tooth need like a cap on top of it to protect it? And get that done as soon as possible. What if your tooth hurts after a root canal? People are pretty confused by that. They're like, didn't you take out the nerve of that tooth? And if you took out the nerve, then why would that tooth be hurting? The answer is there's two kinds of nerves. One of the nerve lives inside the tooth, and that's a nerve that's removed when you have a root canal. But the other kind of nerves are out around the outside of the tooth, and they come from the bone and they come from the skin, and those are different nerves. We don't remove those during a root canal. So picture this. If the inside nerve is gone, that tooth won't feel cold anymore. It can't feel heat anymore. That big significant pain is gone. But then if you're still left with, it's uncomfortable, I feel some soreness, I feel some achiness, that's because of all the nerves out around that tooth that come from the outside world. Now, once the inflammation settles down, once that irritation and kind of that injury from just having dental work done goes away, that feeling usually subsides. I get asked all the time, hey, I need a root canal, but does my insurance cover that? The answer is almost always. Insurance does a really wonderful job of covering root canals. Now, whether they pay 50% or 80% or sometimes even all of it, I've seen all of those scenarios. That's a detail of your insurance plan with your employer or wherever you get your insurance. So the percentages can change, but the fact that they recognize it as a good treatment that saves teeth and prolongs their life, that's pretty universal across any benefit plan you might have. I hope I was able to answer some of your questions about root canals and dispel some of the myths surrounding those and also make it a little bit more approachable. So if you've been told that you need a root canal, if you suspect that you have a malfunctioning nerve, if you just think, hey, something's not quite right, you want it checked out, and you need to decide, do I need a root canal? Is that the right choice for me? Feel free to reach out and contact us. Our number here is 503-786-3000.